So without further ado, let's talk to Dr. Claire on why we get, in particular in menopause, why we get incontinence and what are the different varieties of incontinence that you can have.
So incontinence, what we're talking about is leaking urine, basically. And I think it's probably best to start with the fact that there are two types generally. So there's stress incontinence, where you would leak sometimes if you just stand up, if you're walking, if you're running, any occasion when you increase the pressure inside your tummy, so even like coughing and sneezing. And then there's urge incontinence, and that's like that feeling when you need to go, you've really got to go, and you don't make it in time. And then some people have mixed, which is basically a bit of both.
Wow.
Yeah, and it can be any degree from really mild to really severe. So just leaking when you're exercising, but fine during all the rest of the time, to needing to wear incontinence pads. Yeah. And it is an issue that can get worse in the menopause. It can come out of the blue in the menopause. One of the issues behind it is prolapse.
Tell us about prolapse, because again, you assume almost that you talk about it as if everyone should know about it, but what is prolapse?
Okay, so you need to understand a tiny bit of anatomy. So at the base of the abdomen, so in the pelvis, there's a big sheet of muscle and connective tissue called your pelvic floor, and that holds up our pelvic organs. So basically your bladder, your womb, your cervix, and the vagina. And the
good bit of engineering there.
Good bit of engineering, and the bottom bit of your bowel. And in the menopause, when you lose estrogen, you can weaken the connective tissue of that pelvic floor, and that means that really depressingly, everything can head south a bit. And so what that can mean is that you are more prone to leaking urine. So that's one issue. Other risk factors for prolapse are, for example, if you've had children, if you have a medical condition, which means that you cough a lot or you're very constipated, anything where there's more pressure on that pelvic floor.
And are you finding within my menopause clinic, you're getting a lot of women in menopause with this situation and this problem?
Yes, no, absolutely. It's really super common, but until you ask about it, often people won't volunteer it because, as you said earlier, there's a big taboo. People don't talk about it.
Right.
I think the other thing that it's just really important to mention is, in terms of urgency and your bladder becoming a lot more sensitive and prone to leaking, that can be a direct effect on the bladder of the loss of estrogen as well.
Right.
Yeah.
Okay.
So lots of things conspiring against you.
And obviously we're going to talk about Innovo and we're going to talk about Dr. Ruth in a moment, but when you get your patients in, what are you suggesting or helping them with? Because, you know, menopause is here, but actually incontinence doesn't have to be forever. You don't need to have to wear a pad for the rest of your life, do you?
No, absolutely. And I'm really looking forward to hearing Dr. Ruth talk about her innovative product, because really anything that you can do to strengthen that pelvic floor can really help. So that's the first thing. Sometimes, for some women, not for everybody, pessary that you put in the vagina can help just hold everything back up, and that can help incontinence for some.
Right.
For some, using a vaginal estrogen that you would get on prescription from your doctor can be helpful also. So there's a whole combination of things. Some women end up needing surgery, but obviously that's way down the line. There's lots to try first.
And it's actually talking about it, understanding it and acknowledging that you've got a problem, isn't it? 'Cause at the end of the day, no one should have to put up with these things, and we shouldn't make do and mend either, should we really? So I think that's a great opportunity now to bring in Dr. Ruth, because, as I said, Dr. Ruth is someone who's committed her life to actually exploring pelvic health, and she really wants to actually break the taboos, but also bring it down to get more people understanding that pelvic floor health is one of the biggest things that you can do to help your body and help your life go forward. So, Dr. Ruth, please. Welcome to GenM in Conversation With, but can you just give me can you tell everyone else, I know all about you, can you just give me a little bit, before we talk about the great product Innovo, give us a little bit about your background and why you got involved with creating or co-inventing Innovo in the first place?
Sure, Heather, and thanks very much for having me. So I trained as a physiotherapist and clinical researcher, and I'm board certified in women's health in the USA in physiotherapy. And I'd had a private practice before going into academia and research, and started using ultrasound imaging way back in 2005.
Wow.
In my clinic, because became very frustrated at some women just had a very hard time engaging the pelvic floor, regardless of the expertise I had in the area. So ultrasound imaging gave me sort of a window, a room with a view, if you want, into the pelvis. And I had a huge movie screen in my clinic so women could see what was going on inside. And I soon figured out that at least 50% or more of the women, they just couldn't do the pelvic floor contraction, or they were engaging other muscles. And during my initial education in physio, I was enamored with electrical stim, and I thought it was used in a very simplistic way with just 2 electrodes in one circuit, or maybe 4 electrodes with one circuit. And I decided I wanted to do a PhD, and I was in University College Dublin, and I met with a team that had a novel stimulus program, if you will, or a platform. And I met with them and discussed my idea, and Innovo was born out of there, my PhD, and I validated it using ultrasound imaging simultaneously so I could see exactly what was happening with the pelvic floor. And hey presto, we have Innovo, and it can elicit the perfect pelvic floor contraction. The other thing I had used in practice was conventional stim with those little sort of tampon, vaginal or anal probes. And I had mixed success with them, and did a study to show that only 16% of women using it got a contraction. And that was because of the variability with the nerve input to the muscle. So the nerve will excite the muscle to contract. And there's so much variability that was the issue. It was mostly a sensory nerve that was near the where the stimulus was going. So with this multi-path platform, I was able to put in enormous electrodes. I mean, there's 8 of them. If you've seen the device, they're all the way around the pelvis.
Well, we'll talk about the
side.
actual product in a moment, because I think many people here don't even know what Innovo is right now. So we'll roll back on that one. But you know, obviously you said about women doing their exercises and the Kegel exercises, and I mean, I've done 5 now whilst I've been sat listening to you, and I'm absolutely shattered on it. And yet your product will give 180 Kegel exercises in a session, won't it? Which is a real stimulus. So for anyone who doesn't know, Innovo has been invented so that actually you don't have to accept that incontinence is something for life. You don't have to wear pads for life. You can actually look to find solutions and train your body to be able to combat your incontinence. And Dr. Ruth, now tell us all about this great product and how it works, because again, people here, you know, you've been out in America all this time, you've only just come out into the UK, people haven't got used to what Innovo is, but so please describe it from how you've made it work.
Okay, so Innovo is basically a pair of shorts. It's like a pair of cycling shorts, compression shorts. It has 8 embedded electrodes that are situated around the pelvis and the upper legs. And what happens is there's multiple pathways that we can use to stimulate as many nerves as possible. And because of the variability with how those nerves excite the muscles, this product works very, very well to elicit 180 pelvic floor contractions. Now, I have to say the rest period between those contractions is very important. And that's one thing I'd garnered during my clinical days in clinic, that most of the women doing the contractions didn't take ample rest time, because the rest time allows the muscle to recover before you excite it to contract again. The other thing is it's very comfortable stimulation because the current is spread over a large area. It's about 1,000 centimeters squared of electrodes, whereas the little probe with the tampon-like vaginal probes typically have between 5 centimeters or 20 centimeters, depending on the size of the probe. So it really means that we can blast in this comfortable stimulus and get deep inside the pelvis to get the best contractions you can ever get. And it also has the effect of teaching the user how to do the contractions themselves. So if they're like you, Heather, sitting on a sofa or having a cup of coffee and waiting for somebody, they can do a couple of Kegels, or if they're standing in line for a bus.
And do you think as well, prevention's better than cure? Do you think, you know, we should educate more women to actually do these exercises throughout the life, because, you know, I've had 2 children, I was privileged to be able to have them and everything else, but, you know, your midwife was always going, oh, for the next 4 weeks, do your Kegels and everything else, and you did them for 4 weeks, and then you moved off and thought, oh, I'm all right, Jack, thank you very much. But actually, what you're saying and all your research has shown that strengthening your pelvic floor is an important part of your life. Just as much as we do a sit-up for our stomach and, you know, press-ups for our arms, you believe that we should do Kegels as much as we can for our pelvic health, don't you?
Absolutely. It's just like motion is lotion. If we don't move, you know, our muscles get stiff, our joints get stiff, and our muscles get weaker. And urinary incontinence is really a societal problem that requires a change in attitudes. We can't expect women and men to be tethered to the toilet, because that causes social withdrawal. And the other thing I wanted to say about Innovo is it replicates the reflex contraction that should happen when the intra-abdominal pressure rises. So it's a very quick contraction. Years ago, we were told, hold the contraction for 8 to 10 seconds and do several reps, maybe 3 to 4 times a day. We've always thought that the pelvic floor muscles were weak, and that's the only contributing factor we gave them, except for that you may have problems with connective tissue. But if it was just weakness and we're up against gravity all day long, the prevalence or the amount of urine we would leak throughout the day would increase, because your muscles get tireder because you're up against gravity. But you only experience these leaks during periods of increase in tummy pressure. We call it intra-abdominal pressure, such as during coughing, sneezing, a good belly laugh, or jumping up and down, say jumping jacks around a trampoline. So what we've seen is that the timing of the contraction is delayed in women with stress and compared to their continent counterparts. So it's designed to know this brisk contraction. It's only on for 5 seconds, and then it goes off for 5 seconds. So you have an alternating quick contraction, a rest period, and then a quick contraction. And that goes on for 30 minutes. So you have 180 of those. And we've seen that electrical stim can excite the brain, and the brain can learn. And if the brain learns, then what it does is it upregulates the tone in the pelvic floor muscles, the resting tone. And the resting tone has been shown in the literature to be intimately involved in keeping basically the holes closed, or keeping the sphincter muscle closed during times when the intra-abdominal pressure increases.
Now, we know when we go to the gym, and if you're just starting in the gym and going there, that, you know, the trainer will say it'll take 12 weeks before you really see any difference here, and, you know, everything's a starting point and you build yourself up. So from someone who is incontinent, and I know everybody's different, but on average, how long would it take, do you believe, if you were doing pelvic floor, whether it was using your stimulant through Innovo or doing other exercises for it, how long seriously does it take to start to see a difference, and how often should you be doing those exercises?
Great question. Generally speaking, to increase strength anywhere in a muscle, it takes 6 to 8 weeks, because you add more muscle fibers. However, as I said, I've changed my view on the contributing factors for this condition. You do your coordination much quicker. And what I saw in my initial validation studies was within 4 weeks, women were seeing immense changes. Like 86% of them had seen either a cure rate or over 50% reduction in the number of leaks.
After 4 to 8 weeks?
So what we're doing with Innovo is trying to enhance the coordination and the strength at the same time. It's like high intensity training for the pelvic floor.
Brilliant. Okay. Well, I thought you're the first inventor I've ever been able to speak to, so you are like the James Dyson of the world of pelvic floor here. But Dr. Clare, is there anything you'd like to actually ask Ruth and compare notes on incontinence in your patients?
Yeah, so it sounds really fascinating. So would you say that 4 weeks to notice a difference in leakage?
Yes, with Innovo, that's what we're hearing. And there's been several studies done in Germany and over here, and they've seen terrific improvements in 4 weeks. But you really need the 12 weeks to get, I won't say permanent improvements, because the whole idea after this is that you do the Kegels or the pelvic floor exercises yourself as part of your self-care routine, like you would brush your hair or clean your teeth every day. You should be doing your pelvic floor contractions.
Can we just say as well that obviously I love your product, and you know, I've been quite vocal on the fact that we've got a male colleague in our team who's got prostate cancer, and he's used the shorts as well, because let's be honest, many women in menopausal age are with partners who are actually at the age of potentially having to check the prostate and possibly getting prostate cancer. So this works for men as well as women, and it is a good time to open up and talk about the pelvic floor and the prostate as well for men, isn't it? But how can we absolutely now decide, how can someone who possibly can't afford Innovo, can we talk through what a Kegel exercise would be? How would you describe it to someone who's never done one?
Okay, so I validated another test a while ago with some students of mine, and because these muscles are attached to the coccyx or your tailbone and the pubic bone at the front, when you do the contraction correctly, your tailbone will actually move forward and underneath your pelvis. So the tail does wag. And you can palpate it simply if you lie on your side, and you can even palpate it over your clothes. And I validated this with ultrasound imaging. So you can palpate the tailbone, and if you do the contraction correctly, which I would describe as whatever contraction you need to do to cut the flow of pee off. So if you got a fright, what you would do to stop the passing of gas from the back passage. So if you can visualize what you would do to stop those two, you should be able to do a contraction.
Brilliant. I think both Claire and I's eyebrows are going up here as we're trying it for ourselves here. But no, you're making it a very eloquent description of what you're meant to be doing here. So thank you for that. And how often, if you were just doing that exercise, how often should you be doing that, and how many exercises should you do if you set yourself a certain amount a day to do?
Well, believe it or not, there was a Cochrane review studies done, which is a research study, and nobody knows the exact number of contractions. However, they need to be over 100. That's one thing that people have agreed in, or clinicians have agreed in. So you should do them 3 times a day. You should mix the slow endurance type contraction, which is you hold it for as many seconds as you can, maybe up to 8 to 10 seconds, and try 10 of those. If you can't hold it for 8 to 10 seconds, hold for as long as you can, even if that's only 3. And you also want to do the very quick, brisk contractions I mentioned, especially if you have the leakage. And if you have the mixed incontinence, as was described, because that's quite prevalent in menopausal women, you can do the quick contraction, and that will inhibit the urge to go and may give you some time to get to the bathroom. That's called the urge technique, or urge suppression technique. So maybe 3 times for 10 contractions, hold them for 8 to 10 seconds, and then maybe groups of 20 quick contractions 3 times a day should make a big difference. And also make sure your bladder is empty as it can be before you do your exercises.
Okay. And again, I'm going to go back to my personal trainer now and actually ask him to actually, you know, it's again, when you think about this, you do your sit-ups, you do your press-ups, you do everything else in the gym. Why wouldn't you have 5 minutes in the gym to actually lie on a mat and do your exercises? It should be part of a gym training as well, because it's, you know, you do every other muscle in your body. So I think we need to get more people talking about this and doing it, and actually accepting that prevention's better than cure. So go on, Claire, have you got, you know, this is going really great, and I'm finding some fascinating things out about incontinence, but is there anything else you want to ask or share with Dr. Mayer at the moment?
Yeah, so I'm interested to know how often you need to use the device.
Great question. We recommend 5 days a week for 30 minutes. It doesn't have to be consecutive days.
Gosh.
And that's for 12 weeks.
And then after your 12 weeks, how often should you use that then?
Well, after the 12 weeks, I recommend doing the Kegels every day, some of them, and then different positions. So in bed, standing up, in the shower, walking. Hard to do them when you're walking. When you're doing your sit-ups, you should try and hold it while you're doing the sit-up. And then you could use the device maybe once a week.
Well, I have to say right now, I'm talking about incontinence, I've just been trying it, and I actually thought I was quite fit. And I absolutely am rubbish at it. And I think, you know, as a woman who hasn't got incontinence, I'm now realising that actually just because I haven't got it now doesn't mean to say I won't get it, and actually it's the fear that I have of getting it. So why fear it? Why not prevent it? And I'm like thinking now, H, you do all your sit-ups, you do all your press-ups, you're going to have to add in this into your diet because and into your lifestyle, because we do need more women to know about it, really, don't we? So Dr. Claire, have you got anything else you want to add into this conversation now?
No, only that we were saying earlier, weren't we, Dr. Ruth, that it's really important that you start doing these earlier rather than later. You don't wait till there's an issue, don't wait even till you've had a baby. It's just something every woman should know how to do.
Do you think it should be from puberty then that we actually keep the pelvic floor going?
Absolutely. And I know NICE guidelines, I think, were released in June over in the UK, that they need to get into the schools, and this needs to be part of the sex education for young girls, so that they can know how to engage the pelvic floor at an early age and prevent all this.
I mean, how much do we think that incontinence is costing the NHS right now at this moment in time, from prolapses right through to bladder control, and that's another resource we don't need to have if we can be better prepared, isn't it?
I know, absolutely. And when you think of the knock-on effect, that it's going to stop people exercising a lot of the time, stopping people moving. We've got a big issue with obesity. When you think of the knock-on economic effect, it must be enormous. I don't know the figure, but it must be huge.
Absolutely. So obviously we need, and you're really passionate about this, Dr. Ruth, we need to break this taboo, don't we? We need to openly talk about incontinence, and we need to openly talk about pelvic health. So what do you think we can do now to really not just talk about menopause? It's great that we're trying to normalise the conversation, but let's roll it all into one and talk about, let's nail all the taboos and smash them whilst we're here. How can we absolutely bring incontinence into the topic more, bring it into normal conversation, and absolutely get more men and women doing their exercise they need to do to stop incontinence happening, or if it has happened, end it?
I think the first thing to do is absolutely not accept it, that this is part of life. And unfortunately for women, a lot of them think just by being female and getting older, this is normal because it's so prevalent. 1 in 3 women has it. The other thing is to talk to somebody about it. Talk to your healthcare provider, or even the specialist physiotherapist direct, and talk with your friends. You'll find out that you're not alone, because one can be a very lonely number if you don't talk to somebody. And the other thing is lifestyle changes can really help. As Dr. Claire said, maintaining a healthy weight, avoiding chronic constipation. If you have urinary urgency, avoiding bladder irritants, that can help. But more importantly is, my perspective, is knowing how to engage with our exercises. So many women don't realise, and many people don't realise, that 65% of women with stress incontinence will leak during sex. It absolutely ruins relationships and ruins their quality of life. So the cost of this condition is not the money spent on the pads, which really don't offer anything. It's the cost of what women give up. They have much smaller lives, they avoid exercise, and of course, that can lead to a host of other health conditions associated with sedentary life. Urinary incontinence, it dictates what women wear, it dictates where they go, they plan their trips based on the vicinity of restrooms, and it can affect the careers they have. Because if they're not near a restroom, they won't tend to move up where they don't have access to one, just in case they need to change their underwear or their pads.
It is, I mean, when you say it like that, I mean, it is a horrible thing to experience. And I'm sat here thinking it's terrible when it happens, but actually the irony is it doesn't have to happen to all women, or as many as is doing that. So, what I've learned today is absolutely pelvic floor is not just for when you've had children and end of story, get on with it, strengthen it's for life. And it's from puberty right the way through to menopause and post-menopause. I'm presuming that it still matters as well. So that's been brilliant. But how else do you think, Claire, how else do you think we can start to break the taboo, normalise it, talk about it? What do you think what can do here?
Yeah, I think you just said it. I think talking about it and sharing stories, making people understand that they're not alone. Go and speak to your GP because they'll be able to refer you to a gynae physiotherapist who will be able to support you with your pelvic floor exercises. and give you that more specific advice that Dr. Ruth has already said, avoiding caffeine. For some women, there might be medication that can be helpful. So talk, get it out into the mainstream as we're doing.
And I think that's been, I mean, it has been an incredibly fascinating conversation with you, Dr. Ruth, on a topic that actually is a very hard topic, but one that we just have to acknowledge does happen to so many of us out there. So I just want to take this time to thank you for signing in out in Atlanta. We know that it's a totally different time of day for you as it is to us, but we really do take great pleasure in you joining us. And I'd like to also thank Dr. Claire Spencer here from my Menopause Centre. I hope you'll join us again on GenM in Conversation, and please share with everyone, do your Kegels. Thank you very much.